Glaucoma is the leading cause of blindness, but there's a simple way to prevent the devastating effects. And joining me today to talk about that is Dr. Daniel LaRoche. He's the Director of Glaucoma Services and the President of Advanced Eye Care of New York. Doctor, thank you so much for joining me today.
Thank you for having me.
No problem. So for those folks who may or may not know what glaucoma is, tell us a little bit about it.
Sure. Glaucoma is a disease that usually occurs in the elderly, and that's when you have elevated eye pressure in the eye. When you touch your eye, the normal eye pressure is around 15. But with age and enlarging lens inside the eye, the eye pressure can slowly drift up to about 18 or higher in some people. When that happens, that higher pressure damages the optic nerve, which is the part of the eye that connects the eye to the brain. That's the nerve of the eye, the optic nerve. And when that happens, you get slow loss of peripheral vision, eventually to include central vision, and actually to slow blindness.
In most cases, there's no pain, right?
The elevated eye pressure, it usually goes very slowly. And so that's why people who are at higher risk, people who have a family history, people who are African American, Afro-Latino, should get their eyes examined, particularly starting around after age 40.
And I'm glad you mentioned that because I want to ask you if this is something hereditary.
There is a genetic component. It does run in families. So if someone has a family history of their mother or uncle that has glaucoma, it's more important to be checked. But it's also very important in the elderly. And it's usually due to the lens. Like here's a model of the eye. And inside the eye, we have the lens, okay? And this lens gets larger with age. And as it gets larger within the fixed eye, that causes blockage of the drain and increased eye pressure. That's the most common cause of glaucoma that I see in my practice.
And you suggest everyone should get screened for this. So what treatment options are available if someone finds that they have glaucoma?
Well, we have some new treatment options. You can do earlier cataract surgery or lens removal. That lowers the pressure by about 5 points alone. And while we're there, we have new microscopic invasive surgery with these devices at the time of surgery. That's like a form of a needle that opens up the drain. And that lowers the eye pressure by another 2 or 3 points. And 80% of the time, we can get people off of eye drops. Right now, the standard of care is using eye drops to lower the pressure. But people have to take eye drops 2 or 3 times a day. And that can become quite burdensome, have a lot of side effects. But with earlier surgical techniques that we have today, we can really change the course and prevent blindness in this insidious disease.
So if someone has glaucoma, it's not a blindness sentence, so to speak.
Yes, nowadays we're able to offer earlier surgical treatments with early lens removal and angle surgery, or eye drops thereafter if needed. We've published some studies that 80% of patients that receive earlier surgery do not need medications moving forward for several years. And so that's very, very promising. And that dramatically decreases the rate of blindness from glaucoma. So it's very important that people get their eye exam. It's very safe also to go out during the pandemic because our eye offices, we wear masks, we have plexiform glass, we have spacing. So it's very safe for people to get their eyes examined as well and maintain their routine appointments.
And Dr. LaRoche, you gave me some great tips today. Is there anything else you care to share about glaucoma before we let you go?
Yeah, get your eyes checked for glaucoma. It's Glaucoma Awareness Month. And then not only just glaucoma, but you want to make sure you have the correct pair of glasses. They're going to check your lens to make sure you don't have any cataracts. They'll check the retina to make sure you have no retinopathy. The things that you could also do to help prevent glaucoma and take care of yourself if you have glaucoma is eating healthy with salads, vegetables, baked chicken, baked fish, multivitamins, exercising 30 to 60 minutes a day. That improves the blood flow to the eye and throughout your body and reduce weight and reduce obesity. Reducing obesity is good for glaucoma, and all these things are very important in terms of improving your health and your immune system in this COVID pandemic to help preserve your health and vision in this pandemic as well.
Sounds good to me. Dr. LaRoche, thank you so much for joining us today. I really do appreciate it.
Thank you for having me.
No problem.